Hello and welcome everyone. Thank you for joining us today for our Tourism Business Council of South Africa webinar about the importance of COVID-19 protocol compliance. We would love to hear from you and we'll be taking questions during today's session, so you can place those in the Q&A folder. As I said a little bit earlier, we are not allowing any verbal questions. It's all going to come through on our Q&A folder. Also, chat is open, but please direct your questions in the Q&A folder and not on the chat. Otherwise, I may miss them. A recording of the webinar will be available and will be released to everybody who did register, as well as sent out across the board to all the associations. It'll take us a day or two to get that out. So on that note, I'd like to hand over to our moderator for the day, who's going to get us started. Otto de Vries is a face you recognize, a name you recognize. He's the CEO of the Association of Southern African Travel Agents. He was also the past chairman of the World Travel Agents Association Alliance and is a board member of the Tourism Business Council of South Africa. He's been in the industry for, Otto, should I tell people? Are they going to know how old you are? 32 years, 22 of those in senior management roles in the inbound retail and wholesale sectors. He is a WT AAA delegate to the IATA Passenger Agency Global Joint Council and currently chairs the WT AAA Air Committee and the Marketing and Membership Board Committee of the Tourism Business Council. Otto, the floor is yours.
Thank you, Nats, and good morning, everyone. It's good to be with you, and how fortuitous the timing, considering last night's announcement that the government has declared officially that South Africa has now moved into a second wave. If ever there was a need for us to be having a very, very frank and clear and open conversation around where we find ourselves, now is the time, as we are ostensibly entering our peak period for domestic travel. We are obviously all looking and needing to leverage this time and these opportunities to the maximum, because what we don't want is a situation where we found ourselves in July. So I will be your moderator for today's session. We will obviously be providing time for Q&A, so please do feel free to pass those through as indicated by Natalia on the Q&A session box, and we will endeavor to try to get through as many of those as we can. To kick things off, I'd like to introduce you to our two panelists today. We have with us Professor Alex Vandenhieffer, who presently holds the chair of the Social Security Systems Administration and Management Studies at the University of the Witwatersrand. He holds a master's in economics from the University of Cape Town and has worked professionally in the areas of health, economics and finance, public finance and social security in various capacities in South Africa since 1989. These include positions in the Department of Finance, the Industrial Development Corporation, the Center for Health Policy at WITS, and the Gauteng Department of Health. Work has included participation in the Malamut Commission of Inquiry into Medical Schemes, the Committee of Inquiry into Comprehensive Social Security, and the Ministerial Task Team on Social Health Insurance, and the Health Market Inquiry for the Competition Commission between 2016 and 2019. Professor, it's great to have you with us today, and thank you so much for taking the time to join us. Our second panelist today is Chifiwe Chivengwe. He is the Chief Executive Officer at the Tourism Business Council of South Africa, with 20 years experience in international marketing, business development, international trade relations, and leadership, amongst others, in the tourism sector. Chifiwe has worked for various companies in the tourism value chain, including South African Tourism, Myriad Marketing, FedHasa, and others. He has also consulted for various companies focusing on projects, development, marketing management, travel and events management, and communications. He holds a BBA Marketing Communications Honours, National Diploma in Tourism Management, and a Diploma in Marketing, and he is currently completing his MSc in International Business Leadership and Management with the University of York. So gentlemen, again, my thanks for joining us, and let's kick things off. Alex, I think I would like to kick off with you, if I may. So there we have it. The second wave has been formally called by the South African government. Where does that put us as of today? What is the state of play? Where do we find ourselves now? And obviously, in light of the fact that we are now entering this peak holiday season, where do we find ourselves, particularly when we look at popular holiday destinations across South Africa?
So firstly, I don't really support the language of second wave, as if a second wave is inevitable or somehow predicted or part of some modeling exercise. What we're seeing is a resurgence, and the resurgence has explanations. It has to do with the way people are behaving at this point in time. And as was the case with the sort of earlier rise in cases. So the kind of the trajectory that we're seeing now is different to the one we saw beginning in April, May. And where we saw it start in the Western Cape and then start to rise in the Eastern Cape and then rise in Johannesburg and KwaZulu-Natal. What we've seen here is the Eastern Cape starting this rise, and then the Western Cape following suit. So it went in reverse order. And we're now seeing Johannesburg take off and KwaZulu-Natal take off. So Durban is taking off. And in the Eastern Cape, what we saw is that a lot of this is around the metros, but the rise in Nelson Mandela Bay appears to have trailed off. But the Eastern Cape, so you see a flattening in the Eastern Cape and then a rise again. And that rise is the other districts starting to pick up, the more populous areas. So we will probably see this rise and then a peak and a decline. Now, what's causing this? Well, it appears that the age structure of the new infections, the new cases are younger, and that essentially it comes from people socializing. Simple as that. Whereas the earlier epidemic winter is a very high risk period for an airborne virus like this, a respiratory virus, because people are in enclosed settings and with poor ventilation because of the cold, and therefore it spreads very efficiently. And that's what we're seeing in Europe now. In Europe and North America, well, less so North America because there's lots of bad behavior in North America. But in Europe, a lot of it began with students. Again, a younger cohort who were socializing and not necessarily at university, but they're coming together at university, but they're not transmitting the virus in class. They're transmitting the virus when they socialize. So in pubs, restaurants, and in their own parties. So I think that that's kind of what we're seeing here, given that we're reaching the end of a period in which people were trapped in their houses. So a susceptible, uninfected population started to congregate in large numbers in high-risk settings. And that's basically what we're seeing. And I would argue that a lot of this, it's not a spreading that we're seeing, it's that what we have is a lot of settings where people are behaving similarly. And as the prevalence rises, and the prevalence is the number of active cases, as that rises as a proportion of the total population, the probability that somebody in your group is going to be COVID positive increases. So bad behavior a month and a half ago might not have been noticed because the prevalence was much lower. And as the prevalence rises, so the probability that somebody's going to be there in a crowded setting rises, and then they infect everybody, depending on how they're behaving. And so suddenly you have a group of 50 people infected, whereas the day before only one was. And this has been and I think it's an important issue to understand in this epidemic, is that a lot of the studies have indicated what they call the dispersion factor in this, in that a small number of people, a large part of the driving of the new infections is a small number of people infecting most other people. So once you have that super spreading event, people go home and maybe they infect one other person or two other people, but they don't super spread. So it's the super spreaders that drive the reproduction rate of the disease. So if we contain the super spreading contexts, we're likely to contain the epidemic. Now, so the question is within this rise, what's happening? It's, as I've said, it appears as though in a large number of contexts, relatively young people have been basically behaving bad. And so have proprietors and people of certain environments, that would be pubs, shebeens, also taxis, which are super spreading risk, And then events such as these rage parties, which have put 1,200, 1,300 people in a closed setting in one night, affecting maybe 1,000 people in one shot. So those are what we have, not a generalized set of transmissions from people at the workplace, people in restaurants where the protocols are being managed, where there is good ventilation. And I will go to a restaurant, and the test really is, if you expect that there's one positive person in that restaurant, what you want to make sure is that the protocols are such that that person infects nobody. That's basically the target. So it doesn't matter what's happening. What you don't want to be is the vector. So what we're seeing now is that a lot of contexts have just not been managed. The danger and risk in this period is how government responds to this, and whether they respond with poor strategies that are not very targeted at the problem. And then you have a lot of collateral damage. So I think that the question really in this is how to behave within the context of even rising prevalence and yet still being safe for people. Not being part of the problem, basically making sure that life can continue as per normal, knowing that there's likely to be somebody who's positive in the room, but making sure that that person doesn't infect anybody. And that I think is a key issue to consider going forward. And I think that is very doable. And I do think that what we're seeing now is going to go into decline, because these are related to particular contexts and particular forms of behavior that can be targeted now. Yeah. But we will face risks going into winter, which we probably won't be able to manage through any measure without a vaccine.
To take some of your points a little bit forward. So what we're dealing with here is behavioral issues, and they are quite specific to types of gatherings that are taking place. So when we talk about strategy and we talk about the immediate future, and I think this is quite critical for everybody on this webinar today, is to have a clear understanding of what is playing out and what it is that we need to be thinking about, and also how do we then obviously help to inform the various stakeholders around how this has to move forward. Have you got any quick and some immediate thoughts around what steps are being taken, if they are appropriate? In other words, for example, we're hearing that these rage parties have all been turned off, permissions or permits have been revoked. Is this the right approach? And are these the kind of things that we should be seeing in terms of trying to control what's been playing out over the last week or so?
Yes, I mean, essentially they are the source of the problem, and it's insane that they were actually being permitted. And I think that part of the problem was the message going to relatively young people is that if it's allowed, it's okay, it's safe. That plus, a feeling of immortality. You've got a lot of people who said, well, if it's legal, it must be okay. And so they're kind of relying on government's messaging there. And I think that was a real problem. These gatherings are insane in this period. The virus is going to be with us until a vaccine gives us herd immunity. It's not going to go away. And that's where I say I don't like the language of second wave, because it implies that there is something natural to this. This is entirely a consequence of the way we've regulated large gatherings.
I think we have a freeze on Alex there, so I'll take the opportunity whilst he's frozen just to obviously thank him for those thoughts, and I think very, very valuable. Whilst we see if we can get him back online, I'm going to hand over quickly to Chifiwe. Chifiwe, there was a mention from Alex that was related to protocols and ensuring that we work within parameters, and that good behavior has to be instilled across the entire value chain. And the responsibility obviously sits both with us in the tourism and the larger hospitality sector, but there's also an obligation from a consumer point of view. Now, our focus and role is obviously to inform, educate, and guide our industry. Can you give us, as a collective today, a little bit of a background on the work that the TPCSA has been doing to develop and roll out these protocols, and what it was that you guys did to get government to accept them? Particularly in light of the fact, and something that we can be immensely proud of, is that these are global standards that have been recognized by the WTTC. Can you give us a little bit of a background on what happened, how we got here, and what work we've been doing in order to get this in place?
Thank you, Otto, and good morning, everyone. Indeed, we do find ourselves at a very sort of difficult time. I'm not going to say at a crossroads, but at a time where a lot is being said, and when a lot is being said, it tends to deter those that are potential travelers and those that have booked their travel to seek alternative solutions to traveling. So it is one of those difficult times. I must say that the work that we've done in the past, and we've had many of these webinars talking about the fact that we need to develop protocols, of which all of us sit together. We developed these protocols. We then went into a stage of implementing these protocols. And I must say that we've done so successfully in terms of making sure that the spaces that we have are following the protocols, in ensuring that we don't have situations where our establishments and our experiences within the tourism sector are regarded as sort of super spreaders. Now, the work that we have done, as Otto have said, it is the work that's recognized by WTTC. It is the work that's been recognized by the Department of Tourism in terms of, when the department talks about protocols, and also the work that has been recognized by the Department of Health when they talk about protocols. Remember in the beginning, when we were starting up in the first lockdown, one of the things that we wanted to do, and we did, was to contribute in the flattening of the curve. And we did so using these protocols. The opening of the industry at level 3, in terms of certain aspects being open, it was because we put together these protocols and were able to convince government to let us operate because of these protocols. If you remember, we were supposed to be opening next year, sometime in January or February, when the first risk-adjusted strategy was introduced. So it is through protocols and the work that we've done collectively and the application of the protocols on the ground by all of you that enable us to be where we are today. However, from what the professor have said, we do have a situation where people are not complying to general protocols out there, whereby you're starting to get this prevalence that's becoming higher and higher, and it's starting to impact our industry. Now, we can talk about our industry and say, well, we are organized. We do things in a systematic way. And therefore, we are not the source of the problem at this moment. But the fact is, there is a problem out there. It may not be happening in our establishments, but there is a problem out there. And I will talk more as we go on. But I do believe that the protocols that we've put together, we should be proud of. We should implement those. In fact, during this period, there should be zero tolerance, in terms of anyone who's working in. We should not compromise. There is an eye that's looking at us. The minute you compromise and someone picks it up, it's going to land at my desk and they're going to say, well, Hotel X or B&B X or this experience or that attraction is not following protocols. There is an eye on us. The security cluster within government is looking very closely to what's going on. We do get reports. We should not compromise one bit. It's zero tolerance. We should make sure that anyone who walks into our premises wears a mask. Anyone who's within our premises is social distance. Anyone within our premises, they're sanitizing, meaning that we should get the sanitizers. If we drop a ball, if any of us drops the ball and the eye is looking at them, there will be a report. And then the next thing, we may get a more harsher restrictions, come, New Year. So it's incumbent in all of us, that the protocols that we have all developed, that we are all following, that has enabled us to open, should be followed to the T, and we should not compromise, regardless of who the person is. Whether it's the minister working in there, whether it's the president, whether it's someone who has influence. In fact, those are the ones that we need to be careful of. We should not compromise and say, hey, there's a minister coming in or the commissioner of police, let's give them a different door. Let's not sanitize them. We don't have that room. So we need to be vigilant, and we need to make sure that whatever we do, we do so to make sure that we protect the industry. I think that we've got good protocols, we've got technologies and many other things that we've done. And I do believe that we ought to implement those to the T.
Thanks, Chief. So the message is clear. The work is being done. There's confidence in the protocol that have been developed. What is critical, of course, is execution and consistency in the application. Whilst we have some level of control over how we manage our businesses and how we manage the customers that enter our businesses, we need to continue to ensure that we are doing this in a proper manner, so that the eye will look at us and say, look, they're doing what needs to be done, and we need to be firm and we need to hold ground on this. So these protocols resulted in an opportunity for the industry to further collaborate and work together, Chifiwe, in a manner that probably we haven't seen before, but has been so critical for success. Can you tell us a little bit about the Travel Safe and Eat Safe program that has been developed as a result of these protocols by the TBCSA?
Well, absolutely. One of the things that we have done to make sure that there is access to these protocols is to build up online platforms. That the industry got together, and there has been a lot of people who came in and said they will help in building this. So we have the Eat Safe, Travel Safe website, of which it's accessible to everyone, which gives you the protocols. In that website, you're going to get access to the app that has been built. The app, helps establishments to do the registrations of people that are coming in. You can keep records and so forth and so on. So the app is in your pocket, it's in your smartphone. You should be able to use that. Another thing that we've done, we went further and say we need to provide training for those that need training. So there is training, that's available. I must say it's free of charge. You don't need to pay anything. Is to ensure that those that don't understand what they need to do, they can get training, you can get a certificate, and you should be able to know what to do. The big thing here is that we need to have consistency across the board. The last thing that we want to hear is, we know that in Sandton or in Cape Town or in Durban, things are, working. But, we know that things are not working in this place, up in a rural area or in the township or anywhere else. So there has to be consistency across the board, because when government looks at what we do, they don't look at it from one-sided. It's not a disaggregated approach, whereby, they look at us and say, well, Sandton is doing well, or Cape Town CBD is doing well, and therefore we need to give them exemption. They try to balance, they try to be equitable in terms of the approach. And when you have, an approach that's not disaggregated, you usually go to the lowest common denominator. And when you go to the lowest common denominator, this is where things fall apart, or this is where things start to not make sense to us. And we start talking about the rationale behind it. Again, it's important that these tools that we've put together are used, they are free of charge, and to make sure that there is consistency across the industry, from a bed and breakfast in a rural area, from one in the village, to the 5-star hotel that's situated in the mountain somewhere. It's important that there is consistency. And when the government officials travel around and they go to different parts of the country, they can say that there is consistency. And there's a reason for this. And I'm sure we'll get into that, because we've been having discussion over the past 2 days, regarding, what do we do with the situation that we have at hand? And these are not pleasant discussions. And I will get into that, when the time is right, in terms of what are the discussions that we've been having. But the consistency in application is critical. And let's make sure that we ourselves, I know that we're going to say, but I'm doing it right. Is your neighbor doing it right? Because what happens in your neighbor's establishment, what happened in a restaurant down the road, what happened in a bar or shabin down the road, does affect us. And we're seeing this now. The negotiations are not exclusive, or the discussion are not exclusive to, let's talk about formal industry. It's both formal and informal. And we do know within the tourism industry, we do depend on formal businesses and informal businesses. Our industries across the board. Whatever happens in the informal should happen in the formal, and vice versa. So those are the type of discussions that we have. That's why we've been saying that the technology that's been put out there, it gives us consistency across the board. And it makes our argument better, when we're sitting around the table with government, to be able to argue that, but we have consistency. Even if we don't have 100% consistency, if we are sitting at around 70%, at least we have 30% to work with. We can argue we can have a better argument when we're sitting around negotiation table. So it's quite important that we do so. We use the technology that I've spoken about. You visit the website, it's there in the TPCSA website. All the associations have put this out. We need to make sure that, that consistency is there. And it's not only for now. What we're doing now is going to determine what happens in January. Because the last thing we want is that now, as the prof have been saying, if the prevalence is higher, more people get infected, we don't know what's going to happen in January. And it might be a harsher restriction that may have a devastating impact on our industry. It could be, no more interprovincial travel. And therefore, without interprovincial, you don't have international travel. So we need to be managing this now, so that come January, when we sit around the table, should we have a situation which we may not be able to control, we have a leg to stand on when we negotiate. But if we don't do what we're supposed to do, we don't have a leg to stand on when we negotiate. So it's that important that, whatever happens now, we are consistent, so that come January, come February, if the case shoots up and governments start to consider locking down the country, we need to have a negotiation tool to say, but we've done what we're supposed to do. If we don't do it, they're going to put us in one basket and we're not going to have any negotiation tools. And it's going to be a difficult situation. So let's use those things and let's make sure that, although, the public behavior is out of control, it's something that we've raised with government, and it's something that we've raised with the social partners, labor, community, through network processes. It's something that needs to be dealt with. Unfortunately, the public misbehavior, we are also the public, does impact on the operation of our industry. So something has to be done from that point of view, but technology is there from that point of view.
Thanks, Chief. So maybe just to recap what you've said, I think first of all, the message is clear: consistency in the application of protocols. Use the tools that have been provided. Education and training is available free. The website is Travel Safe, Eat Safe. That's one word, travelsafeeatsafe.co.za. And we encourage everybody on the call who interacts with the public through hospitality, restaurants, hotels, bars, whatever the case may be, to please support the campaign and the process. And let's ensure that we can show the government that the industry collectively is doing its level best to ensure that what we can control is being controlled. What we don't have control over is obviously people's behavior outside of our business environments, but we certainly do have control in terms of what happens within our business environments. And that is on us to not only execute, but to consistently comply and apply, so that we can show that we are doing our level best to minimize any potential further spreading of the disease through our businesses and our business environments. And where there are people that are committed to this protocol and are not behaving, you can lodge complaints with us as well. So there is an email address that has just been posted. Just looking to see where it is. Complaints can be sent to travelsafeeatsafe.complaints@tpcsa.travel. So I'll repeat that: travelsafeeatsafe.complaints@tpcsa.travel. So let's have a little bit of a chat here, because I think one of the things that is worrying me, and I think worrying everybody, is we are, and Chifiwe alluded to it, is that we are looking at this idea that everything's going to be bundled into one basket. We have obviously got different scenarios that are playing out. There's the indoor versus outdoor scenario. There is understanding that this is an airborne-based virus in terms of how it is spread. There are a number of other things that we can and should be doing. And therefore, what and where are the risk areas and how can we manage that the best? What is our role and what is the role of government, so that we don't end up having a situation which we had earlier on in the year, where effectively we were all basically locked down regardless. This now needs to be managed, and it needs to be managed in a manner where we're going to get the best results with the least impact on the economy. So, Professor, from your point of view, what are we getting right? What are we getting wrong? And what can we as the private sector do more of to give confidence to the government that we are not part of the problem, but rather part of the solution, so that our businesses are not affected? And then a follow-on question, and by the way, this question I'm posing is to both of you, but we'll start with the professor, is what actions should the government take? So what should we be doing? What can we do better? And what should they be doing to minimize closures of businesses and the spread of the disease?
So I think that going back to the first issue, what's the key risk? It's poor ventilation. It comes down to that. So any restaurant that's highly dependent on an indoor setting needs to find ways of making sure that they can properly ventilate that setting, which means opening windows and so on. So it's even wearing masks in an enclosed space for any prolonged period is going to significantly increase the risk of transmission in that setting. So given these are the summer months that we've got now, it's the greatest opportunity to sort of minimize the risk easily through opening windows and opening everything to the outdoors. And going into winter, one would have to find a way of doing that. It means people are uncomfortable and cold, but one will still have to ventilate. There's no alternative. That is why we have the upsurge in Europe. So at this point, we're at the easiest part of managing this epidemic. And it really takes extreme bad behavior to see what we're doing, experience what we are. The other risk areas would be the toilet facilities. So they might be poorly ventilated. And so that becomes an opportunity for spreading because, you know, the virus actually is in the feces. It's in that you flush the toilet, it aerosolizes the virus and creates risk. So that becomes a point where staff can be infected as well as the customers. So that part needs to be managed. Now that might not be in the government protocols, because I'm afraid government protocols have lagged behind the understanding of the epidemic. Right at the beginning, they did not message ventilation. They did not message, they said they didn't even message mask wearing. And that should have been up from day one. So, so there is mask wearing going to the toilet. There's a need for making sure that there are windows that can open into the toilet spaces, that there has to be some way of dealing with the air that it isn't recirculated in those kind of enclosed settings. There's the kitchen areas, which might be, so the customers might be in the open space, but the staff are sitting in an enclosed state for that area and they become more risky. So I think the first issue to focus on, it's going to be different in every single facility or restaurant, but it's actually just understanding that that is the problem. That is the risk area. Minimize that risk, and you've substantially reduced the possibility, the probability of transmission. And as I say, take into account the fact that you might have an asymptomatic staff member. The objective is to ensure that that asymptomatic staff member who's positive doesn't infect anybody else because of the protocols that have been implemented. That's the kind of standard. Rather than meeting a tick box standard, that's the standard that you need to meet to actually have an impact. I seriously hope that what we're going to see in the next sort of 3 weeks is that we will see a decline, that we will reach a ceiling in the Western Cape and by area in the Eastern Cape. We've already seen it's trailed off in Nelson Mandela Bay. That shows you the uptick we're seeing in the other districts in the Eastern Cape is like a ripple effect from Nelson Mandela Bay. They're going to rise, they're going to drop. So provided we target the cause of that initial stone thrown into the middle of the pond, it should recede. So I think that the other issue is that beach areas and so on are probably a lot safer than might be presumed, because people see sort of relatively large crowds, but they're actually relatively safe. But that doesn't mean they're without risk. So bad behavior on a beach area is also going to cause some spreading, but 1,000 people on a beach is not the same as 1,000 people in a tent. So, and I take you to you might have seen on CNN the interview in California, a restaurant owner who's been shut down in their area. So there you see where government can basically overreach. She's complaining she's got a restaurant area, it's completely in the outside, well ventilated, and her business is shut down because of the spread in California. That restaurant poses no risk to transmission. And it's insane that it's closed down, but that is the danger, because at a political level, governments don't like being seen to not be reacting to a threat. And so they're responding more politically than they are scientifically. And that becomes a real risk. So I think that those would be the issues to measure. I think just in terms of non-compliance amongst industry players, I mean, I've seen non-compliance personally in some areas. I won't go to restaurants that don't comply with reasonable protocols. I didn't have anywhere to complain about a restaurant, but it wasn't the one I was in. I would never go into a restaurant behaving badly. But I would certainly like to warn somebody. And I think that there is possibly an issue that there's that sort of complaint issue, which might be for people who are members of the association. But I think just as a useful information gathering mechanism, it might be useful to have members publicize a number that if you're uncomfortable about anything, send information here and advertise that, because people might be embarrassed to actually go to a restaurant manager and say, I think what you're doing is wrong, but they might put that information out there. And as that information comes in, it creates an opportunity to have a discussion with what they're doing. And I you know, up to a week and a half ago in my area, I saw a restaurant which had maybe 200, they allowed a separate event with over 200 people in it, must have been. And people drinking, no masks, singing, and got out of that area fairly quickly. And that was completely wrong. So I think that this is also happening, and the more it happens, I'm pretty sure a whole bunch of people got infected at that restaurant on that day, but they were all feeling incredibly safe, and they weren't. So I think that's the kind of issue. In some respects, there's a bottom-up thought process in that each restaurant and each facility thinks through the high-risk areas and works out how to resolve them. It's not merely a matter of complying with a set of protocols. It's actually complying in substance. And I think that really is important at this stage.
Thanks, Alex. Yeah, look, I think this is exactly the point, and this is where there's also an opportunity for us to coordinate from our side anyway, activities around mitigating the risk, but also for us to provide support and input to government around how they can best, you know, support the behavioral component, because I can imagine that it must be quite tough. You know, to your point, beaches are predominantly safe as open areas. But we know for a fact that in certain areas, and particularly over the period between Christmas and New Year, there is a real chance of overcrowding. What is the opportunity there to do some better beach management to ensure that, you know, there's some level of control? Doing a little bit of research, I saw that the Australians have implemented quite some interesting policies on their major beaches in terms of managing it rather than closing it down. And also, you know, from a policing point of view, that they play their role as they would always do, patrolling and ensuring that there is adherence to the protocols. And that way, you know, together hand in hand, we've got a much better chance at trying to keep some lid on this. Jafira, from your side, what else do you think we could be doing and should be doing? And even if you are, as you do on our behalf, talking to government every day, what are you telling them, and what are you suggesting they should be doing so that we are aligned thinking ahead?
Well, I think one of the things that we have to do is continue to talk to government. There are three things that are happening at the moment. Today, the National Corona Command Council is going to meet. It was supposed to meet yesterday. And day before yesterday, we started these discussions around, various issues that the professor have raised. Number one, the issue of restaurants and the fact that restaurants tend to turn into nightclubs when, as the time goes, the music goes up, and when the music goes up, everyone starts to mingle. People are dancing, no one is wearing the mask inside the restaurants, and boom, you have a situation where there are 50, 60, 70, 80 people, or even more, in the same place, and they are trying to have fun. So we have witnessed this in many different areas where we have gone to, and government has picked this up. What does that mean? So from the government point of view on that particular issue is to say, do we then reduce, the operating hours, of restaurants for a specific period of time, in terms of saying, well, instead of, opening until, I think the curfew now is 12 o'clock, do we then reduce it to 9 o'clock? That's under consideration. The decision has not been made yet. But we do know that, restaurants are not necessarily, a problem. The problem comes with shebeens, with taverns, and other places where people are mingling. But a restaurant in Sandton or in Durban or in Cape Town will have a set of protocols that it follows, and everyone, understand that they can go in and out, provided there's ventilation and so forth and so on. So again, we can go and argue that let's have a disaggregated approach, whereby a restaurant, that's following all these things is treated differently. What we're going to end up having is that all the restaurants that are in the suburban areas, and maybe some in the township areas and rural areas, they're fine to operate up to, with the current, curfew that we have in place. And then we're going to have a situation where we say, well, shebeens, taverns, and whatnot that are predominantly in the township areas, we're going to then say they should not be allowed to operate until late. That becomes a political problem because it's not equitable. From business point of view and from rationality point of view, we can argue the disaggregated approach where we can say, let's go and deal with the problem where it is. But from government point of view, when you're sitting around the table, it is the country problem. And therefore, whatever happens on the other side does impact the other side. So that becomes a difficult conversation. So that is on the table. There has been discussions around, should we lower the operating hours of restaurants to at least, 9 o'clock, but not close them down. So there is that may be decided. It may come, it may not come. I'm just sharing this because these are the discussions that are ongoing. Number two is the issue of public gatherings. Now, when we talk about public gatherings, from our point of view, we're talking about formal public gatherings. Someone is having a wedding, someone books a space in our B&B or hotel or, a venue, and then people are gathering. But there's also informal gatherings, or those that don't fall under, the value chain of our sector, i.e. there's a stock fair in the township. There's a traditional unveiling of a tombstone in a rural area. That's still a gathering. Now, we can again go and argue that our gatherings follow the set of protocols. We should not be shut down, and we can go, this is a disaggregated approach. And then one can go and say, but what about the other gatherings? The fact that they don't come through our value chain, it doesn't mean that they are not gatherings. And the biggest issue there on gatherings is that a lot of people coming from different provinces are going to be getting together. So you've got high prevalence in Gauteng, and someone is coming from Limpopo to a gathering, or someone from Gauteng is going to Limpopo to a gathering. That person may be asymptomatic, and then by the time they leave, then there's a cluster outbreak in that particular part of the country, and you don't have as many hospitals. I know that this becomes an issue of, let's deal with the problem where it is, but it then becomes a country problem, because then you have an outbreak in Northern Cape, in Limpopo, in Mpumalanga, Free State. Then we go back to the situation that we were in when we started in March, April, May. So there is that. How do we manage that? How do we make sure that the gatherings continue, and how do we make sure that we send a message to communities that whatever the gatherings that are going to be there has to be protocols. Again, it's a difficult thing to do. It may not impact us now, or it may not be on our value chain, but it does have a direct impact. Should there be outbreaks out there, we will be, affected somewhere along the chain. The third thing is the issue that the professor was talking about, the beaches. Now, we all know that at, January 26th or 25th and December 25th, 26th, January the 1st, there are many beaches that are crowded. And this is usually not tourists, but day visitors that are coming to the beaches. They may want to wash off the previous year. And this has been a tradition for many, many years. Now, we can go and argue that, our guests are not going to be at the beaches during that time. But again, the fact that there's a lot of people that are going to the beach, it means that it's our problem collectively. So now there has been talks of saying, should we then shut down beaches? And we have been saying that, where are we pushing people to when we shut down beaches? Are we pushing them to indoor venues? Because people will do what they want to do. And it's not necessarily our job as the tourism industry to control the masses. Although, the behavior of the masses does impact us. If you shut down the beaches, where do people go? Are they going to go into other closed, unventilated areas? Are they going to go to parks? Where are the people going to go? Aren't we going to be encouraging lots of underground, behavior where people get together in places where they shouldn't get together? Shouldn't we leave the places where we can see people, especially during the day, because the beach activities happen during the day? So those are the debates that we sit with. And these are difficult choices to make. Again, government can say to us, well, we're not going to do anything. We're going to let you be this festive period, and we can be. But if in January, the number of infections are higher and we cannot cope, we're going to shut you down. And we know that in a long term, it's going to have even more devastating impact, going forward. So here we are sitting with a situation where we may have to trade off. We may have to say, well, for the sake of the industry and for the future of the industry, we can trade off, as an example, and this has not been decided, we can trade off that, close the beach on the 25th, the 26th, and the 1st. At least we know that you've got 3 or 4 days that the beach is going to be closed, but across the board, everything is open. Those are the types of trade-offs that we may have to deal with. When it comes to events, we may have to trade off so that we can have a negotiating chip to say, well, with the events, let's reduce the number slightly from what they are today. You've got 500 outdoor, and I think it's 200 indoor, if not 250. How do we trade off that? Can we reduce it to 100 so that we can still continue to have events, and we can have that negotiating power come January? Because there is a possibility, as Professor have said, that if these numbers keep stacking up and they keep going higher and higher and higher, and especially in places where they don't have hospitals and capacity and so forth and so on, government may decide, in a way that we don't want them to decide. But I would want us to think longer term, to say, if we sacrifice 1 or 2 things now, be it an hour of trading, for alcohol in restaurants, be it, we sacrifice few beach days, be it we sacrifice on the number of people that can attend the event, it may put us in a better position to not have a long-term effects come January and February, whereby, we shut down and we're starting from the beginning. And I must say that these negotiations are tough. And these trade-offs, are not easy to decide on. But when you're presented with a situation where government is saying, the medical experts are saying this, they are afraid that we're going to have a situation that we cannot control in January if we continue in this way. They are afraid that, we're not going to have capacity. They are afraid that these things are going to happen. It's the information that you're given. I know that we all would want to receive a document and study it. But, this is coming from government itself. This is, from the horse itself. How do we deal with it? How do we make sure that we look longer term? And how do we make sure that we protect ourselves in a longer term? We can make decisions now. We can say, we don't want to hear anything. We want to continue as we are. What's going to happen in the future? What's going to happen to international travel? What's going to happen to interprovincial travel? What's going to happen to corporate travel and government travel? We're going to have an even more delayed start, to recover, within the industry. So I'm just putting this out there so that, everyone understand that, these discussions are not easy. And as we sit and discuss with the social partners, the labor, you know, the likes of COSATU, the guys from the community through the neglect process, those are the type of discussions that we're having to say, you know, how do we make sure that we save the livelihoods now? And also, if we are to compromise, what are the few things we can compromise on that are not going to harm the industry to the extent that we may be harmed in the next year? So those are the discussions that we're having with government. They continue, they are tough. And also, we need to think of it from the equity point of view, because equity is a big thing in government. We can't only think of only townships. We have to think townships and urban areas and rural areas, because government doesn't want to be seen as, you know, deciding different rule for a township, different rule for the suburbs, different rule for those of us who live in Centurion. They want to decide for everyone, because politically it wouldn't make sense to have different, you know, rules for different areas. So tough discussions, but nonetheless, that's what we're faced with as an industry. And again, the biggest thing, as I've said in the beginning, is that us complying to the protocols that we've put in place is the biggest weapon that we have. And the consistency thereof, it's critical to making sure that, you know, we continue to trade. So I thought I should share that, Mr. Moderator.
Thank you so much, Chief. And I think that's really quite informative. And it was always my thanks, and I'm sure on behalf of everybody on the webinar today, your consistent efforts and hard work and being involved in these discussions and doing what you can to represent us and ensure that government is hearing the plea and the needs of the industry. But just to summarize, I think a few very important points that have come out today. Yes, consistent application of protocols is our strongest tool. It's our ability to show collectively as an industry that we are committed to trying to mitigate the spread, and we're doing everything that we're required to do by applying these protocols. Good behavior, enforcement, while challenging, may still be one of the areas which are difficult. I don't know if there's an opportunity to extend to not only having an email address where we are sending complaints to, but to the professor's point, is there an opportunity for a hotline where we might be able to report these? And how do we then work with the authorities, the community policing, the SAPS, and how can we cooperate better to ensure that where we are seeing non-adherence, that we're able to manage that and support the law enforcement officers so that those kind of gatherings can be managed. And then the third point, which I think is important, is this opportunity of trade-off. This is a long game. This is a marathon, not a sprint, and I think we've all seen that. What is imperative is the actions and the behaviors today is going to affect us in the short to medium and long term. And so it's imperative that we look at trade-offs. One of the thoughts I had is, since government was prepared to give it a try by focusing on one particular hotspot, as they did with the Nelson Mandela Bay area, as part of this trade-off model, where we talk about possibly looking at beaches closed at specific times to mitigate any risk of large gatherings, looking at trading hours of restaurants and bars and pubs, further reducing the number of persons that can be at gatherings, and even, and we haven't really touched on that, whether there is a need to also review alcohol sales with regards to trading hours. These are all opportunities that I think needs to be explored and given due consideration as this process progresses. So I think some really, really useful stuff there, and thank you to both of you for your inputs so far. Natalia, I would like to see if we can start going into the questions. I'm sure I can see that there's been quite a few posed. I'm not sure if you've had an opportunity to collate some of them, because I'm sure there'll be some repeats.
There are some repeats, but actually quite a lot that are in their own right worth posing. So I'm going to, do you want me to pose those questions, Otto? Would you like to?
Yeah, you could, that's great. I mean, you've got them with you there. So if you wouldn't mind posing those questions, that would be fantastic. Thanks, Natalia.
Okay, so I'll start with a question for Chief, probably, from Claudia, who's asked, many restaurants are packing patrons into full capacity with no social distancing. Any regulators we can report them to? So I noticed in the chat there was a lot of talk about RASA. Is there a Tourism Business Council system that can be used to report these restaurants to specifically?
Yes, on the website that we have, the It's Safe Travel Safe website, you should be able to report. Again, the most important thing when you get into a restaurant is to make sure that if you see that they're not following the protocols, you got to tell them that you're not going to go in, and you got to tell them the reason, because we've got many restaurants. So the last thing we want is to be inundated with, a lot of complaints whereby, we're going to be sitting through and trying to call and trying to visit. But what's important is that, let's make sure that, we send a message across to say, we're not going to come in if you're not following any protocols. And we also have to be the police ourselves. I know that we talk about, the police should go and attend to the situation and they should go and shut them down. Let's remember that police have other things to deal with. The way government looks at things, they will look and say, what are the priority crimes happening? You've got gender-based violence and many other things that are happening now. So the police will rather, focus on those type of things, other than this. And also, if the police believes that, we are a problem, remember in the previous webinars that we had, we said that issues of safety and security comes into play when decisions are being made. If the police feels that they cannot police us, or we are out of hand, or they don't have resources to manage us, they're going to say, well, just shut them down because we can't manage them. They'll rather be managing other priority crimes. So the most important thing is to say, all of us, let's take the responsibility of informing the restaurants, wherever we go, that you're not following protocols. You're not doing what you're supposed to do. And if we have to tell everyone that's sitting in that restaurant so that everyone can hear that, they're breaking the protocols, so be it. We've got to protect our own industry. Sending a complaint is great. We're going to receive it. We're going to follow up on it. But, there's time lag, when it comes to that. So let's do what we have to do immediately. In order to get everyone to do that. Yeah.
Linked to that question, Chief, is the question from Annabelle, and I know that this is a problem for a lot of restaurants and bars specifically, where someone enters the premises, refuses to wear a mask, and they say they cannot breathe whilst wearing it. I'm hearing from you that that doesn't matter. They shouldn't be allowed access. They're putting other people at risk.
Absolutely. Don't let them in. Zero tolerance. That's what we have to do. We cannot be compromising and saying, well, it's just this one person. We're going to give them that compromise can put all of us in danger. It can be, the way these things happen, it takes that one incident for a minister to receive a call from someone who's sitting there to say that they are not compliant. Here is the picture. When I'm sitting and I'm negotiating few things, I'm unable to defend, when I'm presented with facts. It's the same thing that, a lot of people have been saying, 50 people, having a party. If I'm shown a picture from the security cluster, how do you defend that? And that's where the problem lies. We are unable to negotiate, when we presented with these facts, because it's a fact. So it's important that, we do what we're supposed to do. So zero tolerance. That whole thing of right of admission is reserved should apply this time.
You heard the man, zero tolerance. Okay. Thank you. You've made that very clear, Chief. I have a question both for Alex and Chief, actually, and it pertains around protocols. We've had a lot of questions today around whether the protocols that we have in place are simple enough for establishments to follow. So there is an assertion that those protocols could perhaps be a little bit too complicated, or in some ways redundant, perhaps. Alex, in your view, you've had a very thorough look at our health and hygiene protocols for tourism and hospitality. Do you think they need a bit of a tweak, a simplification?
I don't think so. I think that, again, the very simple matter that one's dealing with here is minimizing, airborne transmission. And although surfaces are important, people are sanitizing and washing tables, and I observe that. Those are very basic. That deals with the customers. The issue of when somebody can remove a mask in a restaurant is not always clear, but it's impossible to eat without removing a mask. So whenever one is going to be in a setting where one does have to remove a mask, then you want to make sure that the ventilation is good, and that reduces the risk. I see there was a question around, you know, a safari car, which should, you know, should one keep a mask on? The risk is very low in that setting. The risk of transmission there isn't of a super spreading event. And this is where kind of I would almost distinguish between the strategic risk and the individual risk. Is that if I'm sitting next to somebody who's COVID positive and I'm quite close by for a prolonged period, I have a greater probability of being infected by them, but they're probably not going to infect anybody else. So there's that minimization of that individual risk. But at a strategic level, actually what we're seeing now is super spreading events. It's really where one person's infecting everybody in the restaurant, everybody at an event. And I think that the protocols to a large extent focus on minimizing super spreading. And if we minimize super spreading, we're actually having the strategic effect overall. It does not completely remove risk of a one-on-one transmission. But what you want to do is to prevent 10 people walking out after having been infected. On the whole, restaurants don't have a lot of people in them relative to other environments. And so maintaining these protocols means that even if there's one person who is infected, it hasn't caused an escalation of the epidemic. So I think that that's where I would certainly also in the discussions with government and enforcement is distinguish between the risks of super spreading versus other kinds of risks. So and I think that if we are adhering to the protocols as the industry has them at the moment, we would be removing super spreading as a risk in all environments that are compliant. And that I think is really what the target is. What we're seeing, the whole rise we're seeing now has got to do with super spreading. It's got to do with observing nothing and acting accordingly. And those are the instances of non-compliance that you really want to rule out. And what I would suggest really is that moral suasion is quite important. I think that, you know, the one thing is a sort of jackbooted policeman arriving to do something. Actually, it's been quite ineffective in South Africa. I think that in many cases, an industry body has a lot of clout at moral suasion. Speaking to somebody saying, people have been identifying this at your restaurant, it's really not good, and getting a response from that. So managing by exception, I think, is an important strategic approach overall. And I think this is where government really got it wrong right up front, is they didn't manage by exception, they imposed blanket rules. And as a consequence, and this is where I think one does have to be very careful about what one agrees to overall, is that it does matter. If you basically put in a blanket rule, it means people who are safe, who are adhering to reasonable protocols or do not pose a risk of increasing transmission in the country, get shut down with people who are bad actors. And bad actors will continue even with blanket rules, because once you put in a blanket rule, you've got to enforce it on everybody, on 100% of the population. If you put in place a management by exception framework, you're only enforcing and dealing with outliers. And that means that the process of getting some uniformity in a strategy is much, much simpler. And I think that that really has to be the approach going forward generally. But I think that also within the industry body itself is managing by exception. It's the same issue. You're probably only going to have a certain proportion who will be behaving badly. And a large part of them will probably respond to what I'm referring to as moral suasion, contacting them, saying, look, this has been identified. Even without a sanction, you will get a reaction. And then there's a small group that will do nothing, that will sociopathically ignore anything you say. That type of group is actually what the more heavy-handed responses require. The problem with the government response initially was that it imposed a framework in which the heavy-handed response was applied to everybody, and rather than to the extreme outliers. And that's the way to get an efficient strategy to work. I do expect that a lot of these surges that we've seen now will die down, but they will only die down if these protocols are adhered to. The non-pharmaceutical interventions are applied consistently, and these outlier events and activities are curtailed, and they will take a little while to burn themselves out. I mean, they're in a process now, people have been infected. So what you had is in a single event, 1,000 people got infected in one event. Those people are now going home. They're infecting one other person, maybe. Not 1,000, maybe one. So 1,000 goes from 1,000 to 2,000. That comes through in the numbers. But those people who get infected infect nobody. So it goes from 1,000 to 2,000 to nothing, to a very small residual amount. And that's why you see the surges occurring. So I think that that's really the target at a strategic level, is to see that and be able to contribute to that. But I do think that the issue that was raised about whether or not the equity issue in dealing with problems creates a problem in targeting the real hotspots. And I think that this is where a hotspot strategy is very important, is that you look at hotspots. Where are the number of infections that have occurred, and manage those. But if there's a continuous process of generating new infections, then you need to manage that hotspot. If it's a one-off, there was a rage party, they've all gone home, infected their parents, and that is running through. It doesn't matter whether they go back to Cape Town or Johannesburg and so on, because going back there infecting of somebody else isn't a super spreading event. They're going back and infecting is one other person, maybe two other people. And that's the residual effect we're seeing now. So even interprovincial movement is not a risk. It's just a ripple. The risk are those events and contexts that continuously generating them. So I do believe that in terms of reviewing managing one's own risk, so one is not contributing to super spreading, and making sure that when a regulatory framework is considered, that the contexts for super spreading are considered, rather than talking about everybody applying a common rule that may have absolutely no relevance to the super spreading risk. So, but I think that it is very possible applying the current protocols to dampen the super spreading risk considerably. And I think that that basically has to be a line that is held across the board.
Otto, you've unmuted yourself. Did you want to say something?
I want to point out we've got about 10 minutes left, so I'm very cognizant of time. So if we can just have a look at one or two more questions, and then we can close things off.
Sure. A lot of the questions actually, Chief, are, industry coming up with solutions and saying, can we not start putting fines in place for establishments that are not complying? Can we not make sure that these people are detained by the police if they're not complying with the protocols? Actually, many of the questions are around that as an industry. What can we do as an industry, or not what can we do, but what can we tell government to do with people who are not complying? What is the conversation that you're having at the moment with your structured engagements at government level?
Yeah, well, I think that, one of the things that we have to keep in mind, and this happened on the first harsh lockdown. Now, a lot of people, were, sort of given letters to appear in court and so forth and so on, or they were told that they broke, the Disaster Management Act. The problem is that you can't criminalize the whole country. You can't go and take thousands and thousands of people and put them into a court process. We don't have that capacity. And that is why, we saw that, the NPA just threw away all those cases, because you can't criminalize the whole country. Now, I know that we talk about police. I said that the police will give you a story that, they have their hands are tied with other, criminal elements, be it cash in transit and home robberies and many other things that are a problem in our country. We all know about those. Now, the solutions that we need to put out, we have to make sure that, number one, we're not arguing against ourselves, or we're putting a trap on ourselves. Because once we start to say, let's fine, it simply means that, that will just continue as long as the Disaster Management Act is here. The issue that we have to deal with is this festive season. That is the issue. Because in September, we're doing fine. In October, we're doing fine. November, we're doing fine. It's only now when the schools closed and a lot of people start to go out and start to have all these things, this is when we start to see the numbers going up. The concern is that between now, let me put it this way, between the 16th of December to the 3rd of January, there's going to be too much of mingling and mixing. And therefore, there's a potential for disaster. Again, this is just, projections. These are not confirmed numbers. That's where the concern comes in. So in whatever we do, we have to deal with the situation between the 16th to the 3rd of January. If I'm not mistaken, it's like 2 weeks and few days. That's what we need to deal with. And that's when we need to make sure that in whatever we do, our rules have to be, super strict, because this is where, this government medical advisory panelists or scientists are concerned about. So the solutions that we need to have to make sure that during this period, we have stricter, adherence to protocol. Not that we shouldn't be strict any other time, but now we're entering a zero tolerance. I know we're hospitality people.
I hear you.
Hospitality people like to be hospitable, and we like to give exceptions, and we love to say, just come in, we'll deal with it, because we want the business. It's not time now. We need to be more, robust and zero tolerance. So the solution is it's within us. We need to implement the protocols as they are. We need to be strict. We need to tell our neighbors that, they must be strict as well. And if we all do that and we tell on each other, and we all start to have groups, be it WhatsApp groups within the cluster, to make sure that, I saw you people coming into your hotel or your B&B. They were not wearing masks. What's going on there? We need to police ourselves.
So I absolutely hear you and I agree with you. And we have hundreds of people who are on this webinar who are behind you. They're running the same race that you are, but we have hundreds of people who are not on the webinar. And that is a question that has been asked in the Q&A, but it is also a question that I have for you. How we are all, you're preaching to the converted. We're all here listening to you, but how do we reach those people that are not here listening to you? How do we get through to the local tourism associations? How do we as a community filter that zero tolerance message that you've just reiterated, the trade-offs that you have so eloquently mentioned earlier? How do we communicate that right down to grassroots level? Because not everybody at grassroots level is behind you, and not everybody is sitting on this webinar. So what do we do as an industry? What do the people who are in this room right now do to get it down to grassroots level?
Well, I think that everyone who's here is connected to someone else who's not here at the webinar, who's part of the industry. So we need to start the chain of communication amongst ourselves. There are many establishments, that are not here. There are many attractions, experiences, and guest houses, and many other accommodation establishments that are not here. It's incumbent upon us, all 434 of us, if not more, to say that, within our industry, we need to start the chain of communication to say we have entered a zero tolerance space at the moment. We are not, I know we're hospitable people. We are not going to have exceptions when people come to our establishments. We're going to all have sanitizers. We're going to all hold each other accountable. Because if we don't do that, come January, come February, we're going to be having a different conversation. We're all going to be complaining that everything is coming to a halt. So it's important that all of us, we need to go and form a chain of communication. We need to talk to everyone. Talk to the guest house. If you're driving and you see a guest house and they may not be on this webinar, stop and talk to them and say, well, we just had a webinar and we've entered a zero tolerance within our industry. And everyone has to adhere to the protocols in a strict way. Same as restaurants, and same as anybody else, that's involved in our industry. Let's protect ourselves. Let's protect each other. Let's make sure that, we continue to trade, welcome domestic tourists, and also welcome international tourists. I know we can do it. And I think that, we've done many things before. We've been in many, many difficult situations. We're a resilient industry and we communicate to each other through ourselves, through associations, we need to send information across the country to say that, the time is now to ensure that, we are all compliant and we all do whatever we need to do to make sure that, we kept the spread of COVID.
Thanks, Chifiwe. I think we're going to use this opportunity to call a close for the webinar for today. I think it's been incredibly informative, and I think we've really bounced some good ideas around. Thank you to all the participants who have contributed in terms of questions and comments. This webinar has been recorded and it will be made available for those of you who would like to watch it again, or alternatively to share it with peers and colleagues across the entire broad tourism value chain. It is time for us to stand together. It's time for us to show you, to show our customers, to show our best side to our tourists, including all of our foreign partners who are still looking at opportunities to wanting to send tourists here, as well as the domestic scenario that we find ourselves in. This is our peak holiday season, but this is not the time to drop the ball. So let's hold hands together. Let's make sure that we do the best that we can. My thank you to Alex Vandenhieffer and Chifiwe Chifengwe for their contribution on this panel, and Natalia for supporting and hosting, and of course, filtering all of those questions. To everybody, I wish you everything of the best. May you have a successful but well and carefully managed festive season. May you have business and may you have peace and good times with your friends and your family, but do it in a safe and careful manner. Wishing you all the very, very best. We will continue to do our best on our side, and we'll see you in 2021. Thank you so much, everyone.
Thank you, Otto. Recording will be out tomorrow. Those of you that thrown it into the chat quickly, it will be out tomorrow, promise. Thanks so much, everyone. Have a great day. Cheers.